I met a sociology instructor at PVCC who used to work for you. She said you were wonderful.
Was it Kim
She didn't
Hoosier?
have to say, she didn't have to say that anymore.
Was that Kim Hoosier by any chance?
Yes.
Yeah, she's great. Hello.
Good morning.
Hello. Mr. Pinkston, I don't want to put you on the spot, but in the section of the agenda, the director's report, one of the things I just wanted to make this group aware of is the discussion the other night about the personal property tax assistance program. And I'm wondering if you might just say a couple words about that, since you are more well acquainted with the possibilities than I.
Personal property tax or real estate tax?
Real estate tax, I'm sorry, real estate tax.
Yeah, I'll try to say a few things.
Okay, thanks.
Ms. Moffett, I'm working on I've done my training, the 2-hour training, and there's a form I have to fill out.
Mm-hmm.
Do I put your name down as the head of the local LDSS?
Yes.
Okay, great. Thank you.
Hi, everybody. We're waiting a couple more minutes for folks to join, and Janet Morrow, our co-chair, is actually going to lead the meeting today since Shayla's on maternity leave.
It's now 12:01. Shall we get started? I'd like to call the meeting to order. Does that have to be a motion? Or can we just do that? I'm new at this, and I'm going to go through leading the meeting with a lot of help from my friends.
Janet, you can just call the meeting to order. The only thing we need a motion for is approval of the minutes.
Okay, so first on the agenda is approval of minutes. Are there any comments on the minutes?
I wonder if we might just take 1 second to introduce ourselves, since we have so many new folks here who weren't at the previous meetings.
That sounds like a great idea. So, okay, I'll start and then I'll go across as it appears on my computer. I'm Janet Morrow. I've been on the board for a while, but we have not met in person, so I don't know too many of you. So nice to meet you. And next is Patricia Jones-Turner.
I'm Patricia Jones-Turner. I have been a resident of Charlottesville since the 60s and have moved back after retiring. So thank you for having me.
It's wonderful. We're glad you're here. And next on mine is Sue Moffett.
Hi, I'm Sue Moffett. I'm the director of the department. And I just want to add one thing that Ms. Jones Turner left out, which is that she used to be a child protective services worker in our department.
Oh, employment services worker.
Employment services. I'm sorry. I thought you worked for Joan Kameyer.
Well, she supervised both.
So it's great to have former employees back.
Thank you.
Okay, and then Brian Pinkston.
Hi, it's nice to meet everyone. I'm Brian Pinkston. I'm a current Charlottesville City Councilor since January. Married with 3 adult kids, live in the Locust Grove neighborhood, and make my living as a project manager at the university. Thank you.
Okay, and then Remy.
I'm Remy Trail. I'm this City of Charlottesville communications specialist. I've been with the city since January of last year.
And we appreciate your support. Thank you. And then Laura Morris.
I'm Laura Morris. I'm the Chief of Administration with the department. I am under the weather, so that's why I don't have my video on right now.
I'm sorry, take care. Then Connor.
Hi, I'm Connor Brew. I'm the Director of Community Outreach at Movement Church.
And Sarah.
Hi there, my name is Sarah. I am a rising 4th year at UVA School of Medicine. I'm interested in going into pediatrics and I'm very excited to serve. Thank you for having me.
Thank you for being here. And then Cherry.
Hi, I'm Sherry Stewart. I work for Charlottesville City Schools K-12 English learners and TJ ACE, which is the adult education program for Charlottesville and surrounding counties. And that is through Workforce Services at PVCC. And I have 1 child in elementary school in the city, 1 11th grader, and a first year at VCU.
Thank you, Cherry.
It's Sherry.
Sherry, okay, I'm sorry.
Just think German mother being French.
Okay. Thank you, Sherry. I neglected to say that I had foster children at one time, and the one that lived with us for the longest came when he was 13. He's no longer living with us, but he's now 59 and married the daughter we never had. And now I have 2 granddaughters, so I'm a proud grandma. Okay, back. Did I get everybody? Okay. Then back to approval of the minutes. Are there any comments on the minutes from last time? Okay, then we need a motion to approve.
So you're actually approving 2 meeting minutes, October and then February, I believe.
Okay, should we do October 1st? Any motion to approve? Can I make the motion myself? Is that okay?
Yes.
Okay, I'll motion to approve. Any second?
I'll second.
Okay, then the minutes are approved from February, and then October was the other one.
Yes.
Any comments on those? And then we need a motion to approve, which I'll make the motion.
Second.
All in favor?
Any opposed? Then
I'm going to abstain because I was not in the October meeting.
Then I do too.
okay, so I think we're approved of those minutes and we can move on. to Community Matters. And if I'm correct, Brian, you have some information for us.
Well, so Janet, this section would be for if there's any guests from the community that aren't part of the advisory board, and I don't see anyone here today.
Okay. So then, thank you for your help, Sue. I'm kind of
Sure.
lost here.
We'll figure it out.
Okay, and then members report, is that where we are next?
Right, if there's any updates from the members of the board, and then I'll give my update.
Okay, are there any, anything from the members, any information or questions or discussions? Okay, then we're on to the director's report, Sue.
Okay, so this kind of leads me to one thing I wanted you all to be thinking about is what kind of information I can give you to help you learn more about what's happening in the department. I'm prepared today to talk about the biggest challenges on the horizon from my perspective, but these meetings are really to help you learn about the department so that you can be advocates for us and help us also hear more about what we're to advise us on ways we can be more responsive to the community needs that you're seeing from your perspectives. Okay, so I'll just run down my list. I did want to ask Councilor Pinkston to talk a little bit more about one of the things I'm going to talk about, and then I'd love to hear from you about the issues that you were hoping to hear about or what you would like me to be prepared to talk about next time that we meet. Okay. So first of all, I'm not sure if you all are local policy and political geeks like I am, but at the last city council meeting, one of the things that was discussed was the real estate tax and ways to expand on the relief programs for real estate tax. And the mayor had asked some students from the law school, right, Mr. Pinkston, to do an analysis of what options would be available to Charlottesville to expand on existing relief programs. And one of the things that seems like a viable option is for a relief program to be essentially funding for a relief program to be accepted by the local social services advisory board and then to be administered by the Commissioner of Revenue. One of the things that you all, when you complete your required advisory board training, and if you haven't done that yet, thanks, Sarah, I saw your email last night, make sure that you look for an email from the Virginia Department of Social Services. It has the link to the online training. One of the things that you'll learn is the difference between an administrative board and an advisory board. And you all are really an advisory board, which is you don't have any decision-making power in the over the department. You serve in an advisory capacity. As far as a real estate tax relief program, it would really just be a pass-through of the funding, if that is a direction that the city determines to go. So more on that, and Mr. Pinkston, I might ask you now just to, if there's anything I missed or things that might help make it clearer for the members, if you would chime in.
I think that you covered all the relevant points. I do have a copy of the PowerPoint from the folks who presented, and I could forward that to you, Sue, to forward to the group if that would be helpful for people. I think that the connection with the ability to work through the
Not sure what's happening, but it seems like you're frozen there. Okay.
Services.
If everybody could turn on the video, we might have better connectivity.
Let's just come back to Mr. Pinkston once the connection. Mr. Pinkston, can you hear me? Okay, we're going to come back to Mr. Pinkston then, okay? Let's see, back to some issues on the, that are that are getting attention in our department is certainly the annual report, which is one required activity for this body, is to provide an annual report to the city council of the activities of the department. And the body up to this date had decided we were going to update our information from last year to include workload changes, policy changes, and more specifically, pivot to a virtual workforce and what that means for our staff and for our business processes. We do have an agenda set for an agenda date for that presentation, and it's not going to be until September. So we have a little bit of time to get that information to you, and especially since all of you are so new, I was hoping we could take a couple meetings just to talk, to learn more about the operation of the department so that you might have some more thoughtful input to our annual report, if that sounds okay with you. And that really leads me to the last two things on my list, which was meeting frequency, because there is a chance, and again, Mr. Pinkston might have more information than I do, that the city buildings will be reopened to the public in the coming days, in which case this body would be required to meet in person. We would not be allowed to meet in a hybrid model or remotely anymore. And we do have we're required to meet at least 4 times a year, but we had been meeting monthly up until COVID. So that's something I'd like to discuss, get your thoughts on it, if you want to keep meeting quarterly, even if we have to meet in person, or if you want to go back to meeting monthly. What are your thoughts about that?
This is Sherry. I don't mind meeting in person. I actually think it might be better. But I guess we need to look at the COVID numbers, but I'm sure the city will be doing that for us.
Mhm.
Ms. Moffett, can you hear me now?
Yes, sir.
Yeah, I'm not sure in terms of where the city is on reopening for staff. I probably should know that, but you might know better than I. But do we have enough business normally for a monthly, or would a quarterly be sufficient?
My thought is quarterly would be sufficient, but I do think that we would be more effective if we got everybody up to speed on some of the programs and services that our department offers. And it might be best to do that in a monthly format for, say, the next few months, if we can rotate staff in to talk about what they're doing and answer your questions.
Okay, monthly is good with me.
What do you all think?
I think that sounds good. I
Yeah,
think
well-
I kind of defer to your recommendation, and on that sounds good.
You all bring a lot of experience to the table, and I'm really excited about the opportunities on what we can do together. But I feel like we do need to all at least have some basic knowledge about what our department does do, can do, should do, things like that. Okay.
Yeah, absolutely.
I would miss a May meeting, but I believe, like you say, that it would be very good to meet monthly until we're caught up and what all is going on.
Okay, so I can hear Remy having a stress attack while I'm talking, but if the city remains closed to the public, we would continue to meet just quarterly via Zoom. But if we open to the public, then that would be in person. And Remy, that's the response I gave to Mark Zavakar when he asked me what our intentions were. So don't worry about that.
Another option would be every other month, which would give us 6 meetings a year instead of just 4. Since 4 are required, we would be in trouble if we didn't have a quorum. But anyway, I agree, monthly until we get caught up.
Okay, well, so then I will commit to making sure that as soon as there's some information about when the buildings are open to the public and we would be required to meet in public, that gets communicated out to you, okay? We'd be required to meet in person, I'm sorry.
Ms. Moffett, as I understand it, the city council had to enact an ordinance or approve an ordinance, basically allowing in-person or hybrid type meetings for city council meetings and for planning commission meetings. I don't think it's taken any action on other boards or commissions. I think the virtual model is what still is in place. But have you heard anything different?
Well, my understanding is that once the local continuity of governance ordinance is lifted, I mean, the longest that can go right now, based on the last council meeting, is the middle of September. But you all can lift that at any time. And when it's lifted, then public bodies have to meet, except for those ones that city council has already determined would be supported in a hybrid model.
Yeah, that sounds right. Yeah.
Okay.
So we have perhaps until September or maybe sooner to remain virtual.
Yeah, I expect we'll be in person before September for sure. So, but we'll keep you posted on that. Okay. Another thing that the department is getting ready to tackle is we have all of our office spaces are being painted and our carpet is being replaced, which sounds like a great thing, but in the short term is pretty disruptive because we won't have access to the space in our building when that work is being done. We have staff on 3 floors of the City Hall Annex building, so it's the scope of work is pretty broad. It's also complicated by the fact that it does limit our public access because of where the work is going to be done. So we're still working out the details. We sure could benefit from a project manager, but in the short term, we're all learning a lot about how to do this. For our frontline staff, it really is going to be challenging because everybody's responsible for cleaning out their own offices, including emptying their desk, emptying their files, securing all their files, getting their personal items out of the office. It's a lot of physical work. And once we complete that in the private offices, we have to move to the common areas, including our file room, our kitchens, the biz hubs that we have set up. So send us some good vibes and make sure that you're helping us keep our sense of humor, because it's not going to be perfect, and it's going to be a lot of extra work that people weren't asked to do. So we're looking for ways to do fun things, take advantage of the opportunity to do some teamwork, which has been hard during the pandemic. And we're kicking it off with a cleanup day, pack up your office luncheon on May 19th in our space. So we're hoping that is a fun way to start off what's going to be as much as a 5 to 6 month project for us. So it'll be a rocky fall for sure. Do you all have any questions for me? That's really everything I had on my list.
Are you still doing the COVID, what you were doing where you didn't have to make the in-person visits and, other changes that had happened due to COVID?
So we've always made in-person visits for certain programs, mostly for Child Protective Services. We've always done those in person throughout the pandemic. Some of our in-person visit requirements were suspended during the height of the pandemic, including the requirement that we see kids in foster care face-to-face, although we have resumed that. The state's public health emergency is still in effect. So what that means is we are still asking a set of COVID screening questions before we have a face-to-face contact. Our staff has generally been working in people's homes, on porches, in parks. We don't have clients come into the office except for a small number of meetings where there is not really any other appropriate space. But so our foster care staff is out in the field. Our adult protective services staff is now back out in the field because their face-to-face requirements have been resumed, including the requirement that we see persons who are victims of abuse in nursing homes or assisted living facilities. So we had been doing all of those contacts electronically, but those are now being done face-to-face. As far as our public assistance programs, those contacts are still primarily either by phone, mail, or fax, unless the client requires some additional assistance. We're working with the Housing Authority to do some outreach there because their community outreach workers have identified that folks are just generally confused about what's happening with their food stamps or SNAP in particular. So we're working to have staff available either to respond to those community centers or to have regular office hours there. As soon as we hear more about what the need is from the Housing Authority, we will implement that. The policies allowing us to continue people on Medicaid without reviewing their case is still in effect. We don't expect that to end before the fall. But when that does, that will mean we have, right now, we're just over 3,000 cases that are overdue for their review of eligibility. And we expect many of those people will lose their eligibility for medical assistance once that temporary stay on review of eligibility ends.
So will the Medicaid services like completely expire like at a certain point, like do you expect it to completely expire in like September for those like 3,000 cases?
Well, we're hoping not. That we're hoping, what it sounds like is that we're going to be allowed to just start reviewing those cases during whatever month their case was actually due for review. So the workload would be spread out over a year, and then it wouldn't be that like there'd be 3,000 people in the community without medical assistance all in all. But we're still working on waiting to hear the details from the state on that.
For a while, you were able to give maximum SNAP benefits to a household. Are you still able to do that?
Good question, Janet. Thank you. That is ending in July, I believe. It's ending in July.
What about TANF?
TANF is temporary assistance for needy families. It's a cash assistance program that we operate for unemployed or underemployed households with children. So TANF is continuing, although our caseloads really since welfare reform in the 90s have continued to drop. An important part of TANF now is an employment service program called the Virginia Initiative for Education and Work. The VIEW program. So that is an employment support program to help people come off of TANF before their 24-month time clock ends of eligibility. In addition to that, we did during the pandemic get some funding to resume our employment services program for SNAP households. So households that aren't on TANF but just receive SNAP. We're now able to provide employment services and employment supports to those households for a limited period of time. We just hired that staff person. In fact, I don't think she's even started yet. Has she, Laura?
Yes, he has.
Oh, there you go. Sorry, I missed that one. So we don't think we're up and enrolling people yet, but we were pleased with that funding and to be able to resume that program.
Thank you.
Are you working with Network to Work? Maybe that's one of those things that we'll get to over the next few months. But as they try to help people gain employability and employment.
Yes, yes, Network to Work, we're a really close partner with Network to Work, and both of those programs overlap a lot. Network to Work has generally more flexibility and funding for support services that we don't necessarily have a way to pay for, but we partner closely with them. It might be would it be helpful if we had somebody come in next time we meet to talk about employment services and supports?
Yes, I think that'd be great.
Okay. What else would you like to hear about in our coming meetings? Any particular topics?
Ms. Moffat, I wanted to ask, I'm not sure, I know that Region 10 there's a separate board for Region 10, but I was wondering if there's any sort of overlap with the social services in Region 10 or overlap between us and any mental health resources in the community that you might discuss.
That is a great question. And there is an overlap in that we often work with the same folks. But one of the things, it's easy to answer for kids. For kids, we really purchase services from Region 10, and Region 10 is our community services board, which is our community mental health and substance use provider. So for kids that are entering any kind of residential care, they have to be screened by Region 10 to determine that they have a level of need and make sure that the Medicaid is in place to cover the services that the youth needs. For adults, although many of the folks on our caseload are receiving services from Region 10 for a variety of reasons, when it comes to mental health crises, the clinicians at Region 10 really have the training and the expectation that they are the responders for that. So they're the folks that meet people in the emergency room and screen, say, for a temporary detention order. We would perhaps recommend that, be able to inform the clinician of some of the things that we have seen, or talk to the magistrate's office, or be at the magistrate's office requesting a TDO be issued. But really, when we're looking at whether we accept a case onto our adult protective services case, so that it's where the need is only mental health, we ask ourselves, is there something we bring to the table that Region 10 isn't already going to bring to the table, so that we are not overlapping or duplicating services?
Thank you.
Hey, Sue.
Yeah.
Just because I've been helping a lot of the recently arrived Afghan families, some working with the IRC and some not. It appears that there's no place to rent in Charlottesville practically. And a lot of the clinics don't have space. I'm sure things will change once they get new residents in July or June, but I'm wondering if we can address Charlottesville busting at the seams. Schools, medical facilities, mental health facilities, always, just because we don't have enough and we don't have any for children. But I'm just wondering if we can talk about collaboration with other organizations and if there are any new ideas for approaching that, just because it seems like we've had kids who have been out of school for 9 months, 3 months in Charlottesville, but and then I don't know if they're going to stay in the city because some of them have leases until July, and those are potentially houses that students can rent, but it's an issue. And I think that, affordable housing obviously is an issue for everyone. I'm just wondering, with this influx of people, it continues to make the situation more difficult for people who are trying to stay in the city, I guess.
That's a big question. Let me take the housing piece first. Mr. Pinkston, if you'd like to chime in, you're welcome to. But I would say there are a number of groups that serve in an advisory capacity to city departments that are working on the housing issue. And I feel like we've all gotten together as local government officials or service providers and talked about that, but we've not gotten our advisory groups together to talk about in what kind of advocacy can this group do, or how could you inform an advocacy platform as we move through this program, through this problem. And there may be an opportunity for that. I hadn't thought of that, Sherry, so thanks for bringing that up. But one group that comes to mind that just had a listening session is the Office of Human Rights. And one of the topics that they asked for input on was the housing issue in the city. And so that I can find out more about how that worked, or if any of you all went to that or heard about that. I'd love to hear your thoughts on it. But one of the things with social services is we really would support those things, but we don't we don't have a mechanism to add to that. So we would support, we would advocate, we help define the need. Like I can tell you how many families, for instance, either from the IRC or from our child welfare caseload that we're supporting in hotels because there's no affordable housing in the area. I can tell you that, but we don't have funding to rent a house or build a house or
Right.
purchase a hotel, but some of those other things that are happening on a macro level as far as housing goes. Education is a little bit different. And I know there are several kids in the city that are unable to attend school either because of the housing issue or because of the vaccination issue. Again, those are not enrolling your child in school very quickly becomes a child welfare issue. So our role is really just to advocate or to help define the need so that the folks who have the ability to change those services understand the urgency of it.
Yeah, I mean, some of them do get the waiver of McKinney-Vento if they are in a motel or hotel, which we have done. But we've just had, our English learners program for K-12 has kind of sat around the same number for several years. And for the first time, obviously, because of this influx, we have 75 new students within a 2-month period. So that's hard on the school systems as well, because it's hard on everybody who's helping to enroll them. It's hard on finding spaces at this far out in the school year. Of course, it's beneficial for those kids to be able to get into school so that they could potentially participate in school activities in the summer. One of the other things you said that I know that social services is providing benefits for some of the families. So one of the things that I have done in the past, not super successfully, but I've offered it through adult education, is some kind of parenting groups. But I didn't have the funding for interpreters at the time. I have noticed, just because I've been doing a lot of home visits with a lot of the newer families, there are some families, well, a lot of the refugee families are used to having the bigger village in place. But I noticed some things that were happening in a neighborhood recently, and even an American neighbor was complaining with regards to supervision and safety. And I'm just wondering if I know that they do things through the IRC. Not all of the families have participated in those if they were resettled somewhere else and chose to come to Charlottesville on their own. But I'm just wondering if there's a way to collaborate also, because they're inundated with information when they first arrive, but just as rather preventatively rather than after the fact. I know like the screen windows were pushed open, for example, and the kids were poking their heads and bodies out and the neighbors were concerned. Little ones were taking the car keys and turning the car on, and like 2 years old, and the neighbors were upset. And I'm sure that's not an isolated case. There are a lot of kids in these newer families. It's Ramadan and people are probably tired. And I'm just wondering if there's a way that we could support those families through some of the education that goes on through IRC in a way that's sustainable, so that they keep hearing the information rather than get in trouble because something happens.
Sure, thanks for bringing that up. And here, I'll tell you what we're doing, and then I would love maybe either this meeting or our next one, we can talk more about the services and programs that are available for persons who are new to the community. But as far as the concerns that you're mentioning, those are still, it's a culture clash between what the child welfare laws are in this country and what is some of the communities where our new neighbors are coming from, whether that be a refugee camp or a different country. And so the child welfare laws still apply. So we work to make sure that our own staff has a high level of cultural competence with the various communities that are settling in Charlottesville. We have developed a vendor list for our Child Services Act dollars, which are the monies that we can spend to purchase more specialized services for kids who come into the child welfare caseload. So we've worked with the IRC to make sure that they're an approved vendor so we can pay their clinicians to do some education and intervention in primary languages and by with a trusted voice from the community. We work with international neighbors, and other than that, we attend the monthly meetings with the International Refugee Committee to talk about what's happening and to learn about what's happening. And we do participate in at least before COVID, they have kind of onboarding for their caseload as new families entered the community, and our staff was part of that. It's a tough one. We don't want to, this is one of those situations where we want to be part of the solution, but we don't want people afraid to come to us with what the problem is, right? Because we don't want families to be afraid they're going to lose their kids if they call us. So I'd love to hear your thoughts on what, especially from your perspective, on what we can do to better help support those needs, those issues. Not aware of any current cases we have that involve those issues, but they certainly have happened in the past. And we've worked directly with the neighborhoods on that about how to call us if you see something like that. And just to make sure that people know they can remain anonymous so they aren't, concerned about their neighbors. But you also really heard a lot of your experience there, and I'm thinking a lot of people might not even understand what McKinney-Vento is.
Okay, sorry.
How important that is. So one of the things I put on my list to make sure that when we get to child welfare, is to talk about how we serve homeless families, and that just being homeless doesn't necessarily mean that you're not a good parent. So we really would just work to help people have safe and secure shelters so that they have time and energy to work on other things that their family needs. Do you want to just tell people, Sherry, what McKinney-Vento is real quick?
I mean, I'm not an expert either. I kind of have learned about it more because of some of our newer families not having a permanent place to live. But it in the city and the county schools do it completely differently. And the county schools has a whole office that is dedicated to that. And that may be because they have bigger populations. But it's a law that is that provides services for families that are considered homeless, and that could be temporarily living with other families and tight quarters or whatever. It includes our newer families that have arrived, and that can waive them from some of the requirements for vaccines, et cetera, as long as that's something that they put on their list of things to do. But it also provides certain services such as extra tutoring, transportation so if they are in a motel right now and they get assigned to the school where the motel is, because that's how they did it, they can get transportation paid for by this this funding that helps them stay in the same school, so they do have some kind of normalcy. And that is one of the reasons why the city schools have received so many new students, because that influx of families that came in after they were at the bases for X amount of months, getting some health screenings, et cetera. A lot of them were put into the hotels in Charlottesville, and the majority of those that they were put in were in the county. But then when they found housing, either through IRC or community members that are from the same country, a lot of those were in the city. And that is why some of them were able to stay in Albemarle School if they had an older child, or if they wanted to keep their kids in the same school just for continuity. Otherwise, we registered quite a few families over the past few months. But I don't, you might know of some other services that that provides, Sue, I don't know, besides tutoring and transportation and support for the family.
No, the basics of McKinney-Vento, you got right on the head there, Sherry. It's to allow kids to remain in school regardless of what happens with their housing situation. So it's very serious. support, but we can talk more about that when we talk about child welfare for sure. It's
Okay, yeah, so as far as what I was concerned about with the safety issues and the different laws that we have here in comparison to the laws in other places, or if they even have them. I'm just wondering, you said that you had worked with IRC. Do you do classes for the parents, telling them what is allowed and what is not allowed? But what about those families who actually didn't come through IRC? I know that eventually, well, they stopped the allowing people to do walk-ins at a certain point just because they had too many people and not enough staff. So I'm just wondering, I've been registering some of those families who are getting help from some people that are already here. I'm just wondering if they're not working directly with IRC yet, how are they going to know about all this, about
Yeah.
things that are allowed and not allowed?
That's a great point. Yeah. So I'd love to hear your thoughts on that. If you just want to send me a quick email.
Okay.
Also, it might be, we also work by community. So we kind of rotate through the public housing communities and talk to the staff. We really believe that families are the experts on their own families, and we want to support the community in being able to help each other. That we don't want people to be afraid to come to us if they need some help. So I'd love to get your thoughts on that. There's no formal mechanism to touch base with people who aren't coming through the IRC. So we typically would not hear about that until there was a problem. So.
Okay. Thank you.
Ms. Moffat, just to expand and touch on something that Sherry had touched on, you had mentioned like the issue of housing and shelter in the area. And I'm sure everyone knows this, but it was something that I'm continually surprised to learn, but the Salvation Army is the only congregate shelter that's open right now. And they have exclusionary criteria such as not being able to climb up to the top bunk. And in the hospital, we have had to share this to patients that they are not eligible for the only shelter that's available, despite their homelessness, because they are not able to climb to the top bunk. Just as an example of one of the criteria. So also Premier Circle is a long-term shelter in the area. That wait list is 4 to 6 weeks. So that, I'm not sure if folks had heard, but that's not an immediate shelter option for patients that are at the hospital, homeless and needing a place to recuperate and live after we discharge them. So I just wanted to touch on that and bring awareness if anyone wasn't fully aware of it.
Sarah, would you just add why you know so much about this?
Oh yes. So there's a program that was started last summer at UVA by a graduating medical student named Jacqueline Carson. It's called the Inpatient Homeless Consult Service. It's now been taken up under UVA Health as one of their population health patient programs, also working with other programs that monitor patient needs in and out of the hospital after discharge. But I currently serve as the director of the Inpatient Homeless Consult Service. And so patient teams who identify someone who is experiencing homelessness and might have potential difficulty with finding housing after being discharged contact us, and we go interview the patient and discuss resources in the area. And so that's my familiarity with that.
So homelessness is, or housing in general, affordable housing is, a challenge in the city for sure, and all over the country right now, but in the city for sure, and it's getting a lot of attention. And maybe you all saw the news that a number of persons who were living in homelessness actually served a petition to the Thomas Jefferson Area Coalition for the Homeless and several other departments, ours is one of them, demanding some shelter. And they were demanding, the petition was really for permanent housing, but in the series of listening sessions that happened over the next few months, the ask was really for an expansion of emergency shelter. So as Sarah said, and please call me Sue, don't call me Miss Moffat, but as Sarah said, the only shelter that is open all year round in our community is the Salvation Army. And it not only does it have a number of physical hard stops for people, but you also, you have to have a breathalyzer before you can go in. You have to get up and go out and search for jobs in the morning. There are a number of rules and regulations, and there's very limited accommodations for families or persons that might need some other special considerations. They're looking to expand that, but right now it's just not there. So there is across the country in January every year, there is what's called the point in time count, the PIT count, and every community is required to count the number of persons that are actually living outside on that night of the year. And then there's a whole nother component through the schools. As Sherry mentioned, the McKinney-Vento Act requires the schools to report the number of children of concern in their school system. And then that data gets delivered to the Area Continuum of Care Agency. The lead agency in our community is TJAC, the Thomas Jefferson Area Coalition for the Homeless. That is the organization that is responsible for the administration of federal, state, and local housing program dollars. I sit on that board. I'm one of the Charlottesville representatives on that board, and Anthony Haro is the executive director of that organization, and he's giving a presentation at the 4 o'clock work session to City Council on May the 2nd about the PIT count. And that's certainly, you can watch that. You can download it at any time after May the 2nd, or we can send it out to you all for your information. But that report, I haven't seen the draft yet, but we've been talking a lot about it, and it's just going to give the City Council an idea of the number of folks in the city of Charlottesville, adults and then also families, who are actually without housing, and help the city position to set some priorities as far as, does affordable housing include shelter for persons who have no housing at all and may not have any income at all either. That information might be useful to you all if you decide, if we move to more of an advocacy position on that. But again, we are not a homeless services provider, but I can tell you, we put a lot of money into sheltering people at any given time. And we did put aside some of the federal dollars that became available during the pandemic to shelter persons in hotels in the event of severe weather or other natural disaster. And we've been spending that.
That would be great if you could forward a link to that.
Absolutely, yeah.
And it's absolutely critical. I look out at the Historic Society where a person was dead one morning.
Yes.
Just a very few weeks ago.
Yes. Now, I would say that person was not necessarily living in homelessness, but he was in that area that night. Yes.
He was there frequently with his boombox.
I guess also, Sue, I'm worried that for some of the folks who are newer that maybe had some cash and were able to put down 6 months of rent in the city that don't have jobs yet, once those 6 months are up, I'm just wondering also, just because it has such an impact on the kids as well, going back and forth, which happens. I mean, there's always some transients, but with all of these short-term leases, it seems like there's the possibility that we could have a lot more, and what kind of effects that's going to have on the students, and the families, just trying to integrate into a community and having to move around so much because they don't have and I know some of the families are applying for public housing. Do you have any information, or Brian, do you have any information about what the wait lists are currently for public housing in Charlottesville?
Excuse me, I sure don't. It sounds like Sue, a follow-up meeting might be good to have around the topic of housing and homelessness.
Yeah.
The next time we meet, Deputy City Manager Sam Sanders has got a lot of both past work experience and knowledge here that he's a subject matter expert. I'm not. I think that might be something of value.
I agree, but I do want to make sure that you all understand we are not a homelessness services provider. So I would like to maybe talk about the intersection of the work that we are mandated to do and funded to do with homelessness and the challenges that presents, so we can help define the program to the people that are solving that. So Sherry, I believe the issues you were talking about was specifically related to refugees, whether they come in through the IRC or just not through the IRC into our community. And yet that is a big problem. What we have done is, again, partner with the agencies that do provide those services. And we also have, as part of the Family First Act, the new federal change to child welfare, we have an additional full-time social worker and a parent navigator that are going to be focused on the schools. So we are expecting that the target population for that will be a lot of the newly enrolled children and their families in the schools, especially in the preschool program, for one of a better description of that 3-year-old program. And right now we only have one social worker in there. So we're going to, double or triple our capacity. So it's in it. One of the things we're anticipating is that they're going to be working with a lot of those folks. But yeah, I'd be happy to, get some of the staff who are working directly in that to talk about how they see homelessness affecting our caseloads. And, it's not just, especially when we're talking about families, it's not just homelessness. It's people who are what we say couch surfing, right? They're living 10, 12 people in a 2-bedroom place, and it's not safe. We're doing some good work with the fire department on community risk reduction, and I can hear that you all are very interested in that. So I'm gonna I'll put together a little calendar just to make sure that we can get you all up to speed on what's happening with the agencies that we are partners with versus what we're mandated to do. Okay.
So can you maybe give us information about the intersection with all of the agencies in town that work with families and children, like CHP and Ready Kids and some of the others? I know that there used to be parenting classes run by Children, Youth and Family Services that turned into Ready Kids, right? Wait, did they switch? Did they switch into something else?
Yeah, they're ready Kids. Yeah.
Okay. Yeah, but I don't think they do those anymore. And I feel like there is a need in our community. And so I'd be interested in hearing more about that as well.
Well, what we can do is walk through the resource guide for sure. That I think what you're thinking of is Child Health Partnership. They do in-home parenting instruction.
Right.
As a prevention.
I'm familiar with them, but that's pretty limited also. And there's a wait list for that. And a lot of their clientele speak other languages. So then that requires interpretation. But doesn't Ready Kids do some in-home, or is it just neighborhoods?
I'm actually not sure, to tell you what they're doing during COVID, Sherry, but right. I can certainly find out. So what we'll do is we'll send a bunch of information out to you all, including the most recent street sheet, which gives a list of a great summary of resources that are available to folks, and kind of highlight the ones for you that intersect with our programs, and get your thoughts on that. How does that sound as a place to start? And I'll start with our next meeting, scheduling someone to, sounds like you want to prioritize homelessness over employment services, but I haven't heard from everybody. So tell me where to start.
When we meet in person, can the meeting still be recorded? Like, I'm going to miss the May meeting, and I would love to be able to get that information if possible.
I think the answer to that is no, but because we just don't have the capacity for that. And my understanding for boards like this, where we're not a decision-making board, is that we'd either be in person or virtual. There would not be a hybrid option available, but we could, we can decide amongst ourselves. Certainly there'd be minutes in any presentation that was given. We could make sure that you have, okay?
Thank you. We have just a few minutes left. Is there any other comments or any I guess, Sue, would you entertain if people think of something they want, could they just email you? And we can add it to the list, which is getting longer and longer?
Yeah, I was just gonna say it, that would be very helpful to me, so we can focus this and maybe get more complete information about a single topic to you, as opposed to kind of a broad brush at each meeting about many what are urgent issues in the community for sure.
Sue, is there any update on the hiring process for the new director? And are you applying for that position?
I am the director. I've been the
Oh,
director since last May. Yeah.
Oh, gosh. See,
Yeah.
I'm out of touch. So I missed that, I guess.
It's human
Congratulations,
services
a year
still has an
late.
Interim, I think.
Stuck with me. Yeah.
Yay.
The city is working to fill some other key positions, the communications director, director of communications and community engagement, director of human services, and director of human resources. Interviews are either in process or have recently been completed for all three of those positions. So that'll help a lot.
Sorry, I missed the boat on that one.
No worries.
Well, thanks to everyone. Thanks especially to the city for their support in our meeting. And thank you, Sue, for an outstanding meeting. I think we've made some decisions and have a direction to go here, which is wonderful. And I guess you will be sending out the information about our May meeting and where it will be, and any policies about masks or vaccinations or whatever.
Okay, I'll do that.
Anything from anybody else before we close, just on time? Okay, I move to close the meeting. Is that the proper procedure? Any objection? Otherwise, we'll see you next month. Thank you so much.
Thank you.
Thank you, everyone.
Bye.